How's everybody doing this morning? Wasn't I just here a minute ago? It's great to see you all. And a huge welcome to our members, our staff, and guests who've been watching us on Zoom. It's amazing. So who's ready to make some noise? And I want to make sure that everyone knows that the nurses and healthcare professionals are in the house. So we're going to get loud, but I want you to do it by region. Where is Region 1? And 2, where's 2? And 3? And 4? And 5? And where the hell is Ona? This is how I love to start my day at PCM. I don't know about you. Feisty, active, and full of rowdy and amazing badass members. You're smart, you're strong, and you constantly raise my bar to push me to be the best that I can, to lead our ONA and make us a force that no one takes for granted ever again. I'll get through this part, I promise. I am so proud and honored to be your provincial president. And together, we've made huge changes in the past year. We've transformed our approach to bargaining. We've launched a new brand and a renewed brand, and we've gotten stronger and more organized. And it hasn't always been easy. I'd be lying if I said that. But every time I felt like it was too much, you were there. When I looked to either side, you guys were shoulder to shoulder with me every time. And it's true. You inspire me to new heights. It's you. And I don't mean CN Tower heights. I want to be clear about that. Because Heights and me, we don't get along. I don't know if everybody, the board knows. But I want you to know, and I think you already know this, I don't fear Ford. I don't fear speaking up at Queen's Park. And I don't fear speaking out against anyone who dares crosses nurses and healthcare professionals. Not CEOs, not MPPs, not ministers, no one. You have me on your side. I'm going to tell you right now. But put me up against Heights and throw a snake or two in there, and well, I got to draw the line there. So I want to talk about, now hold back the laughter here, about the F word. Not the F word you're thinking about, that I've been known to use, but F words nonetheless. I seem to be saying a lot of F words, you know, feisty, fierce, fight, Ford. I see a theme here. And you may not know that I have a passion for words. You know, they're commanding and they have an impact on your confidence or your well-being and our actions. And even swearing and using the great big F word, that's power. So were you aware? I love it. That one's edited. We're not there yet. So were you aware that swearing can positively impact patient outcomes? How many in this room have sworn and it has positively impacted patient outcomes? Yes, it has. It's a fact. And a fact, see, there's another F word, fact. So as nurses and healthcare professionals, we've been told for far too long that we can't express ourselves plainly. That being fierce, forceful, feminist, or fighting back is not professional. Now I say, it's well past time to tell it like it is. It's well past time to speak the brutal truth. Ontarians trust nurses and healthcare professionals, and when we talk, people listen. Do you agree? Donna agrees. And we must use that power to advocate for the most vulnerable, to fight for better care in our hospitals, in our clinics, in our communities, and to fight for a public healthcare system that puts people before profits. Do you agree? And so I say we should reclaim all those F words and the power that goes with them. Let's reclaim it. All of them, even the edited one up there. So speaking of building power, who wants some good news? Because it's not always good news. Some news to inspire. Our path to being the best badass union there is out there. I am stoked to announce that more than 1,800 new members have joined our ONA. You heard that correctly. And our ONA proudly welcomes registered nurses and nurse practitioners from Credit Valley Hospital into our membership. And these members are joining our movement, and together we will be stronger. We know this. You've heard me say it over and over again, and we will fight for the respect that we all deserve. We are ready to support Credit Valley nurses in their fight for improved working conditions, patient care, and so much more. And I'd like to congratulate Cheryl DeLung and Joan Alfonso Piche, who are the new site representatives at Credit Valley. Let's give them a round of applause. And Grace will have a little bit more to say about this remarkable group of nurses in her report, so stay tuned. ONA now represents nurses in all Ontario hospitals except for 2. And I'm going to let you in on a little secret. We are not finished organizing in Ontario hospitals yet. And they are still squarely on our radar, and I'm going to just leave it at that. Stay tuned. Our ONA comprises more than 68,000 nurses and healthcare professionals. We represent more than 18,000 nursing student affiliates. And as you just heard, these numbers are going up, up, up. Our union has dedicated and passionate staff who back us up and support us every step of the way. And our labor siblings across the country, across the province, in our communities, they lift us up. And we lift them up. It is going to take efforts like you've not seen before, to fight misinformation, disinformation, and untruths. And over the past while, it seems some of our communities have become dangerously polarized, filled with falsehoods and uninformed spin. And some of it, I know this will be a surprise to everyone in this room, from our very own government. It seems like there's a growing distrust in the experts and those with lived experience. And as nurses and healthcare professionals, we have a responsibility to push back. The public looks to us for facts and to call out legislation that threatens public health care. So in late summer, Ford Conservatives announced the forced closure of 10 supervised consumption sites. Shame. It is a shame. And under the Ford government, municipalities will now not be allowed to create any new sites, shame, or participate in federal safer supply initiatives. That is a shame too. There's a lot of shame in this part. Make no mistake. This will lead to preventable deaths, and this is not an exaggeration. I wish it were. Ford has made some very bad policy decisions in his 6 years as premier. I think we can agree on that. But this fact, it bothers me. It bothers me personally and profoundly. This decision is unethical and it's cruel. He did not speak with those who work at these sites or those with lived experience. This is a life and death decision. And the Ford government is moving ahead with closing the sites by March of 2025. I want us to all say right now, shame. Shame. Supervised consumption sites save lives, full stop. So I'd like to ask Hannah Stahl, Bargaining Unit President at Parkdale Queen West Community Health Center, to come to the stage to talk about supervised consumption sites. Hannah. Where is Hannah? Are you supposed to use the stairs? Safety first, Hannah. Come on over here. Watch the wires. Hannah, I appreciate you being here. Can you tell us what supervised consumption sites are and the clients who use them?
Can I sit?
Yeah, you can sit. That's why I put it there. Yeah.
Does everyone in here know what a supervised consumption site is? Like, raise your hand. If you, okay. I encountered a lot of nurses who don't. So, but we do. So, they're small spaces exempted by the federal government to allow people to come in with their own drugs and use them safely, and that's about it. They're built as a response to the toxic drug crisis in which we find ourselves, where people are, what they're buying on the street, they have no idea what the potency of it is. They have no idea what other drugs could be in the product that they think they're buying, and it's creating a really, really deadly environment for people who are just trying to survive. So my site in downtown Toronto saves about 2 to 3 at minimum folks every day. That's how many overdoses we have every single day, and people who are able to continue living. So this is a major thing going on at our site. And these sites were kind of created with the philosophy that OD response shouldn't be a burden on lay people in the community. It shouldn't be a burden on the kids and families and community members that are finding people on the street. And it should really be in the hands of trained professionals. And I think it's really unethical that the Ford government is putting this on the backs of our communities and kids. So my role as a nurse in the SCS goes beyond just overdose response. I provide primary care, I do cancer screenings, pap tests, basically anything that people would access from a family doctor, just on a drop-in basis, very low barrier, referrals to treatment if people are ready for it, referrals to housing, a million different things.
Yeah.
Counseling. My clients are largely unhoused, and they also exist at many different intersections of vulnerability. We see like racialized communities overrepresented in our clientele, Indigenous communities, women, people with disabilities. And a point I want to drive home is that as we talk about reconciliation, the closure of SCSs is also a conversation of the continuation of colonial violence. We know that Indigenous women bear the burden of overdose deaths 8 times more than non-Indigenous women. And SCSs are one of these services that are built to respond to the calls of action from the Truth and Reconciliation Commission. And by eroding them, we're directly causing violence to these communities that rely on them the most. When the government of Alberta closed the Lethbridge SCS a couple years ago, 90% of their clients were Indigenous. And I just want to say that to like frame the context in which we're talking about this. Like, this is racist also.
It is racist. It's a shame. Who agrees? So how do supervised consumption sites fit into the larger context of the healthcare system?
So we've had federal exemption for sites in Canada for about 7-8 years now. And in that short amount of time, we've gotten really strong data. What do we know about SCSs? We know that they greatly reduce 911 calls in the surrounding communities for overdose and for other things as well. And they greatly reduce the burdens on our emergency response teams. Every overdose call in Toronto takes up paramedic teams' time for an average of 2 hours from start to finish. And so you can think about how, with the closure of these sites, with the several overdoses that we respond to every day, how that's going to impact EMS response times going forward. And then down the road, they help reduce ED admissions and the overwhelm that our emergency departments are already experiencing. Data also tells us that overdose deaths are reduced in the 1-2 kilometer radius around each site, which is really profound. Again, alleviating strain on emergency services. SCSs reduce transmission of bloodborne infections like Hep C, HIV. And a point that I shouldn't even have to say, but I really want to drive home because the government is hell-bent on associating these sites with crime, is that there's no data indicating that these sites increase community violence or crime. Again, there's no data indicating this, yes. And the government is blatantly telling the public lies and making up fake data, and they haven't cited any sources for these claims.
Shame.
And so these are facts that we know of, but also from taking a step back to a philosophical lens, SCSs are really, on a policy level, a really radical approach to care that reframes how we approach folks who use substances away from a coercive approach that drives people into treatment, away from a law enforcement, carceral criminality approach to drug use, and it really centers health and the health of folks who use drugs in our response. SCSs aren't profit-driven, unlike treatment centers that are unaffordable, largely private. The public ones, I know people who have been on wait lists for 2 years. SCSs are a public fixture of our healthcare system. And in the larger picture, this is about privatization and siphoning funds out of evidence-based community services that we know work and into more moral approaches to drug use that aren't evidence-based. And I guess the last point I'll just say with this is that people who use drugs are very easy targets of conservative propaganda. We saw it in Alberta, where once they closed all the SCSs, they started removing other services for unhoused folks, and then they moved on to sex education and reproductive rights, and this is just a domino effect that even if it doesn't affect you right now, I hope people can understand the way these things impact everything down the road. And yeah.
So who's with Hannah? So from a nursing context, why are supervised consumption sites so vital to have within our communities? I think you've named a number of reasons, but.
Yeah, I think at the end of the day, people just need a place to go. The vast majority of my patients don't want to use drugs in public, but that's the only place they have. They don't want to use drugs on the steps of a church or in a schoolyard. That's not what people want to do. They want dignity, and they don't want the public eye on them when they're doing these things. But if people are homeless, they really have no place else to go. And taking away SCSs, you're taking away the one place where people could access the healthcare system and use with dignity and safety. I want to mention that SCSs aren't in opposition to treatment-based philosophies to care. They're complementary. Some of the most dangerous times in a person's life who uses drugs are when they're kind of in these in-between stages of just been discharged from hospital onto the street, or they've just been released from prison, or they're waiting on a wait list to get into treatment. And the sole purpose of SCS is to keep people alive during those periods. And people who are dead can't access detox beds. So we need to understand this as an interconnected service. My role in an SCS, I've worked in an SCS as a nurse for 4 years, and I've administered naloxone twice, which is really surprising to people. I think lots of the people in this room and lots of nurses that I talk to, their experience with overdose response has been in an emergency department environment. And I think a point for you guys in particular that I want to really emphasize is that community-based overdose response is truly the best evidence-based, compassionate clinical practice that we have. When people overdose on the street and they're responded to after a few minutes, if they're lucky, and there's already been time for brain damage to set in, they have traumatic experiences with paramedics and the emergency system, and they might be administered CPR, which is really traumatic. Naloxone, the way it works is if you have dependence on opioids, it drives you immediately into withdrawal, which is really painful and like a horrible experience for people. And so it makes sense why some of the worst OD recoveries that people see are in ED, where people are being pumped full of naloxone and the patient is having the worst day of their life. And sometimes that comes out in violence against nurses. I've responded to thousands of overdoses in the community in SCSs, and I've never had someone violent towards me, ever. Because when you're there, when the person is using, you can respond quickly. Sometimes all it takes is giving them a little bit of oxygen, repositioning them, and being able to stick with them while they come back out of it. And like, our patients deserve better, and I also think ED nurses deserve better, because this trauma that both parties are having to experience because of the short-sighted way that we respond to overdoses is really, really harmful for both parties. And the moral injury on ED nurses is incredible, because they also have to bear the weight of a system that is failing people, and they're the downstream responder to that, but they have to bear the full weight of it, if that makes sense.
I think it does. So this type of nursing takes a great deal of empathy, compassion, and courage. Can you tell us a bit about how you came up down this path?
Yeah, I've always worked in the homeless sector. When I was in my second year of nursing school, my older brother died of an overdose, of an accidental overdose. He was 28 years old. He would have his birthday would have been last week if he was still alive. And our hometown where he overdosed still doesn't have an SCS, and it never will because of Ford's policies. But I know that I'm not alone in that. I think that most people in this room statistically have been impacted by the overdose crisis, whether directly or a friend or a family. And it's not a unique experience in Ontario, as much as I wish it was. And yeah, through my work, I get to tell my patients how valuable their life is and make people feel cared for and seen, because I didn't get to tell my brother that. And my role as a sister and a harm reduction nurse is to keep your loved ones alive. That's it.
Thank you. Thank you. Can we give Hannah the biggest round of applause ever? All right. So Ona will not back down on this. And I urge everyone, if you hear a member, a colleague, or anyone who agrees with Ford's BS on this, a rash decision is the formal way of saying it, please talk to them and explain to them why this is a very bad decision. It's terrible direction. We need everyone in on this fight, everyone here and everyone on Zoom, and you have the incredible power as ONA members to help reverse Ford's decision. But we also have something else. We must not be afraid and unwilling to take no for an answer. Unafraid to have the difficult conversations. Who's ready to fight on this one? That's what I like to hear. Speaking of being unafraid, I'd like to acknowledge ONA member Michelle Bobala. Michelle is a forensic nurse and sexual assault nurse examiner who works at Women's College Hospital. And it was an honor to present or to co-present our union's submission to the Standing Committee on Justice Policy on Intimate Partner Violence with Michelle. This is a first for ONA, by the way. We haven't presented in front of this committee in recent memory, and I don't think it'll be the last time. Michelle is a clear example of one of our members fighting for some of the most vulnerable people, survivors of intimate partner violence, just like me. Michelle and I went to Queen's Park to present our submission to the committee, and Michelle spoke her truth. There she is there. She demanded that the government call intimate partner violence an epidemic, and she answered questions like the fierce nurse that she is, with facts, with power. And it is my absolute pleasure to call Michelle up to talk about this experience. Where are you, Michelle? Yes, I saw you over there. My sister. You want to sit or you want to stand?
Sure.
Sit? Okay.
Thank you.
Okay, Michelle. You know, I'm grateful for you to be here and to talk to us about the epidemic of intimate partner violence. What are you seeing in these communities? Can you talk about your work?
I work as a forensic nurse and sexual assault nurse examiner, as you mentioned, at a sexual assault and domestic violence care center here in Toronto. And our team sees hundreds of patients each year. We provide care to folks across the gender spectrum who've experienced sexual assault, human trafficking, and domestic or intimate partner violence. And sadly, it's been notable in both my practice and the official statistics that the rates of violence are going up and the severity of that violence is increasing as well. And to make matters worse, when someone experiences sexual or intimate partner violence, it is crucial that they have access to the necessary supports to ensure their health and safety, but that is definitely not the case all the time across the province. More often than not, shelter beds are full or non-existent, and that's especially true in rural areas. There is a severe lack of safe and affordable housing, so survivors of violence often remain trapped with their abusers. Counseling can be out of reach due to out-of-pocket costs, and many free services have wait lists of months to years due to the demand. And sexual and intimate partner violence also have significant downstream impacts on a survivor's physical and mental health, and the lack of access to primary care and early intervention supports for mental health means that survivors are being subjected to the double injustice of living through abuse and then becoming sick because of it. Yeah. And without the appropriate supports in place, survivors of violence are often at risk of long-term illness, disability, or even death. There's also not enough forensic nurse examiners doing my job available in Ontario to support survivors, meaning that when a patient reaches out for help, a forensic nurse may not be available for hours or days or at all within their region. As forensic nurses, we specialize in crisis intervention and forensic and trauma-informed healthcare. We provide emotional support, documentation of the assault history, complete assessments, inclusive of injury documentation and photographs, which can later be used in court. And we also complete sexual assault evidence kits and offer healthcare options such as STI and toxicology testing, STI prophylaxis, and emergency contraceptives, and help connect patients to follow-up care and community resources. For many patients who are able to access care from a forensic nurse, it is the first time they have told someone about what they've experienced. And being heard and treated in a way that makes them feel believed and supported can really go a long way in terms of helping a survivor regain power and control after it has been taken away in the context of violence.
I have been an emergency department nurse. I think everybody knows this, for more than 2 decades, and I've seen some similar things, unfortunately. So why is it important for the government to acknowledge intimate partner violence as an epidemic?
Well, Bill 173 seeks to enact the 2024 Intimate Partner Violence Epidemic Act, which would require the provincial government to recognize that intimate partner violence is an epidemic in Ontario. And in its submission to the Standing Committee on Justice Policy in support of Bill 173, ONA recommended that the bill be accompanied by comprehensive legislative action and investment in services and supports to ensure that intimate partner violence is recognized and addressed with urgency.
Yes.
In other words, officially declaring intimate partner violence an epidemic will put pressure on the government to actually do something about it. It should help mobilize prevention efforts, policy changes, and funding streams to increase access to support services, and act to bolster collaboration across sectors, including healthcare, social services, and the criminal justice system to improve outcomes for survivors. And additionally, the impact that work of sexual assault and domestic violence nurses can have on survivors' feelings of empowerment, using the term epidemic in itself in public discourse will also help to validate survivors' recognition of their experiences. It will push for the services, supports, and policy measures that they deserve to achieve support, safety, and justice.
So I understand that this was the first time you spoke. Remember when we were getting ready in the CAF there, in front of Provincial Committee at Queen's Park? So what was it like? Any surprises?
Well, it was a very powerful experience, and I was honored to be asked to join you to speak about the issues facing survivors, so thank you so much for that opportunity.
Thank you for being with me.
Forensic nurses provide practical but highly impactful health care and support to survivors of sexual and intimate partner violence with every patient interaction that we have. And that work is extremely meaningful, but it's not always easy to hear repeated stories of trauma and not be able to find all the solutions that our patients need. So having the opportunity to try to affect change on a broader societal level helps to address some of that moral distress nurses can experience when repeatedly witnessing that disconnect between a patient's needs and the limited resources that are available out there. So being brought to the table to speak truth to power about sexual and intimate partner violence felt both very empowering and truly like a natural extension of the clinical role of an RN working in this capacity. And in terms of surprises, even though Bill 173 is a private member's bill brought to the table by the opposition New Democrats, the Conservative government reversed course on its initial plan to vote it down by instead of requesting the advice of the Standing Committee on Justice Policy to conduct the study that you and I got to speak to at the provincial legislature. 58 women were killed in the context of gender-based violence last year alone, so the evidence is and has already been clear for a very long time. We are not doing enough to prevent sexual and intimate partner violence and support survivors in this province. And all of that's to say that I don't really think another study was actually needed. The time to act was a long time ago. But I was heartened by the fact that both the opposition and the government asked good questions and seem to really be listening to our testimony and the testimony of other experts. And that makes me feel hopeful that the bill will get passed and that change may be afoot.
Thank you. I thank you for sharing your insights. You know, that was a powerful day. It was a tough day. And you were absolutely amazing when you spoke our truth at Queen's Park. Let's hear it from Michelle. Oh, you go. Use the stairs, Michelle. Linda will get all upset. Now we have to roll. So I'd like to acknowledge the members and staff who provided the details that formed the basis of our submission. They are ONA members Michelle Bobala, Michelle Green, Leah Venema, and Rosemary Olivia Ha. ONA staff members, including Health and Safety Specialist Denise Werner and Paul Ravello, Library Technician Vicki White, and Labor Relations Officer Jill Moore. Our external expert was Danielle Bisnar, external legal counsel, and ONA government and an external relations specialist, Imrit Kaur, brought all the expertise together in this submission. And they get a round of applause. It was amazing. There we were, two fierce nurses sitting in the pink palace, as we call Queen's Park, speaking truth and making demands to shift the system. And it was a powerful moment. You can see we have our game face on there. The standing committee created a subcommittee to study intimate partner violence. Apparently, there will be many phases to this as part of the study to help the government figure out what it can do to end this. But frankly, as Michelle said earlier, we don't need to waste any more time studying intimate partner violence. We've had the solutions for decades. We need action. Who agrees? Both the government and our employers have had more than enough time, but they've chosen not to act on the solutions. So last month, Andrea and I spoke before the Standing Senate Committee on Legal and Constitutional Affairs as part of its study of Bill C-321, an act to amend the criminal code. And this bill aims to amend the criminal code to require a court to consider that if the victim is a healthcare worker, it is an aggravating circumstance for sentencing. And this is an amendment that the Canadian Federation of Nurses Union, Linda Salas is right over there, has pushed for, and we support it as well. The Senate is known as the chamber of sober second thought. It's true. And it is a bit of a solemn place filled with deep history and tradition. Andrea and I went, there we are, we're sober. I promise. Andrea and I went to the committee room and sat among several esteemed senators. I provided my opening remarks, and we were poised to answer the senators' questions. And the senators respectfully and intently listened to our brutal truths about pervasive assaults and violence we experience in our workplaces. They asked very insightful questions and were engaged in the discussion. And it was very surprising, especially the senator from Cornwall, Patty. This is a true story. But the stories were missing, so I told mine. I told them about the many assaults that I had experienced as emergency department registered nurse, and they listened intently. The senators needed to hear about the harassment threats and the workplace violence injuries that are happening in our long-term care homes, community, and hospitals, how home care workers typically work alone and do not have support or sometimes even cell service in rural areas to call for help. That is a shame. And one senator asked me if any charges were laid to any of those who had assaulted me. And my response was no. The senators were interested in staffing ratios and how implementing them will help to curb the number of assaults. Intelligent people. Something concrete that could be done to help us in our workplaces. Don't you find that interesting? So there will be opportunities for amendments to the bill, and then it goes to third reading for a final vote. So stay tuned for additional information on the outcome of this important bill. So this past summer, the gift of the gab here, I was invited to be part of the Women's Health Care Panel at the Ontario Chamber of Commerce. True story. Now hear me out. The Ontario Chamber of Commerce is a network of 60,000 businesses from all corners of this province. And they represent the interests of businesses and look out for their members just as we do. But unlike us, they have very close ties with the Ford government. And in fact, Minister Jones attended and spoke before the panel. So you can imagine how that was. It was awkward. The panel I was on was called, and I'm not joking here, Supporting Our Healthcare Heroes, Women as the Backbone of Ontario's Healthcare System. So I had reservations, I want to be perfectly clear, but there was an unusual, it was an unusual opportunity to bring our message to a group of people who we wouldn't normally agree on much with them. I think we can all agree that we wouldn't agree with them. And yeah, maybe I wanted to shake things up a little bit, to be blunt and direct about what actually is happening in healthcare, to cause, a little bit of, it's an S word, an SH word. So what happened? Well, you know me, I didn't back down. Ona's voice was heard loud and clear on a number of issues. I spoke about pay equity, workplace violence, the state of healthcare, perhaps most importantly, women in leadership. And my co-panelists included there we are. Look, I look nice. Aw. My co-panelists included Dr. Maria Lees of the Federation of Medical Women of Canada and Jennifer Belcher from the Ontario Pharmacists Association, and I was pleasantly surprised with these two. Maria was fiery about women in leadership, and Jen spoke at length about workplace violence and how organizations and governments must do better to protect healthcare professionals. Does this sound familiar? We were a motley crew up there. And after the panel, I was literally swarmed, for a lack of a better word, with people coming up to me to introduce themselves and talk about the issues as women in healthcare. So in fact, the president of Pfizer approached me, or the vice president of Pfizer approached me, but you can see we're having a little conversation there. And I made sure she was aware that my union, our ONA, fights for universal public health care, including a comprehensive pharmacare plan. So, we didn't hit it off, but she did give me her card. And as experts in Ontario healthcare system, it's important to take opportunities like this, to bring our message to as many people as possible, including those who have differing opinions. So that's what I was doing there. We must challenge new audiences and tell the brutal truth. You're going to hear me, I'm like a broken record. But every time we do, we show others who we are. A bold, feisty union that does not fear power. Does not fear power. Not even the vice president of Pfizer. So who here has seen the movie Groundhog Day? The one where a person experiences the same event over and over again, and it's a very, very frustrating watch, to be honest with you. Well, I had my own version of Groundhog Day happen in July at the Council of the Federation. Yes, indeed, remember the annual gathering of Canada's premiers and nursing leaders. And you may recall last year's disaster when I met with Premier Ford. If not, here's a reminder. So, why is my face like that? Why am I frosty? Because he was disrespectful to ONA and nurses and healthcare professionals last year and was again disrespectful this year. He showed up late. again, see, wearing a wrinkly golf shirt, while his counterparts were all dressed in suits, but you know, I'm not going to be petty, I digress. And at my table sat myself and Dawn, Manitoba Premier Wob Canoe, and Darlene Jackson from the Manitoba Nurses Unions, our brilliant Canadian Nursing Students Association President Tiffany Campbell, Doug Ford, as you can see here, and his Chief of Staff, Ivana Yellick. And she was giving me a frosty or frosty 2 glare throughout the entire event, by the way. The morning speaker was Dr. Jane Philpott, an expert in primary care. So I tried to talk to Premier Ford. Premier, and this is what I said, do you know that more than 2.5 million Ontarians do not have access to primary care? And you can do something about that. And the Premier responded, is it that high? And as the Premier of the most populous province, this should be basic information. Well, for him, obviously not. You can see I'm not happy with that response. So I tried again. Premier, you should know that most are women, racialized and historically marginalized. And while they may not be your voter base, you are still responsible for them. And he didn't have a response. He just sat there staring at his blank dossier in a fancy leather-bound folder. You can see right there, he looked at it most of the time. So I tried another fact about violence. Premier, are you aware that nursing is one of the most dangerous jobs in Ontario? And this piqued Ford's interest. He says, no, Erin, it's policing. That's what he said. They get guns pulled on them every day. So of course, Ford would defend the police. It's a male-dominated profession that was exempt from Bill 124, if everybody remembers that. And I believe, actually I know, some of his family members are police too. That's a surprise. So we went back and forth, and I said that nurses are assaulted every single day. And I have been one of them. I told him about my workplace violence experiences with broken bones and black eyes and being kicked in the abdomen when I was 8 months pregnant with my son. And I would not back away from our truths, our brutal, brutal truths. And he blurted out, oh, this is absurd. There was a little bit banter in between, but it's not appropriate for here. So he stood up from the table and he shoved his hand toward me to shake. And I stood up with him and insisted that we meet on fixing these issues affecting the healthcare of Ontarians. And then he just left. He just got off and left the event, and he didn't even stay long enough to be in the official portrait of the Council of the Federation. You can see it there. You can also see Dawn and I being real friendly. So that's my Groundhog Day moment. For disrespecting nurses and healthcare professionals, disrespecting our members, and disrespecting ONA. And I want to be clear. If the provincial government would like to meet with ONA, we will be there. But we will not rubber stamp any issue. We demand real respect. And that means influence and consultation on the policy issues impacting our members and the healthcare system. No rubber stamping. So let's talk about the upcoming provincial election. Who knows that we're going to have one soon? Okay. Pretty much since the end of summer, the rumors and innuendo have been rampant. I think everyone's heard. When will Ford call the next provincial election? So technically, the election is scheduled in the spring of 2026. However, the Premier can call an election at any time. And the question of the day is, when? Some say it's likely to be spring 2025, so 6 months away. Regardless of when the election is called, we must be ready. Who agrees? We must be able to hit the ground running as soon as the writ is dropped. Our provincial advertising campaign and on-the-ground organizing will continue to be the anchors during this election. Our campaign continues to reach new communities through TV and online ads. Let's take a quick look at our current campaign.
The government's also snuck some legislation in really kind of under the radar when it comes to privatization and allowing for, a more two-tiered model of healthcare. And a lot of people are not aware of what's going on. And it's scary because it kind of feels like the government has sort of run their own game with our very fragile system, and it's kind of crumbling underneath us.
A message from the Ontario Nurses Association.
Doug Ford and his government has not improved the healthcare system whatsoever. I do work in long-term care, 300-bed home, and one of the biggest changes that I've seen is the lack of staffing and resources. The quality of care that our patients and residents are supposed to receive, they are not getting it. I believe everything Doug Ford is doing is intentional. The truth of the matter is, point blank, he does not care.
A message from the Ontario Nurses Association.
Being in the North and Indigenous, we have our set of challenges, and serving our marginalized population without the support is unjust. Now is the time for change to be action. The Ford government could release billions of dollars for healthcare so that we have the funding to do our job the way it's supposed to be done.
A message from the Ontario Nurses Association.
These are our members in their own words. Who else thinks that's amazing to see? So although the messages will be different for our provincial campaign, similar themes and stories will be a huge part of our push to get Ford and his band of MPPs out of Queen's Park. And I have a lot of hope, and there's much promise. Don't get down, we got this. There are several ridings across the province where Conservative MPPs are trying to stay above water with their constituents. And I'd like to talk about a few here that we can flip. We got this. Let's start with the mighty Region 1. They know how to get it done. Current Thunder Bay Atikokan MPP, Kevin Holland, Donna. Only won his riding last time by just over 3%. This is a historic swing seat, and there's currently a primary care crisis that Kevin has not managed well Well, if at all. So over to Region 2. Knows how to do, you know just what to do over in Region 2. And there are 2 prime ridings that can be flipped. MPP Lisa McLeod announced in September that she will not run for re-election in Nepean. Yay! I'm nonpartisan. Former ONA member Tyler Watt has the Liberal nomination. So this could be a flip riding. And there's been so much pushback in the Haliburton community with the closure of the Minden Emergency Department. MPP Laurie Scott will have a target on her back because of how she has failed constituents about the Minden closure. And then in Region 3, who knows where to be? Let's talk about York Southweston and MPP Michael Ford. He's Doug Ford's nephew and narrowly won last time. It's well past time for no Ford to be part of Queen's Park anymore. It's now time, where's Simon, for them to move on. All right, hardcore Region 4. Where would you like to flip? How about none other than Parry Sound, Muskoka? Yes, Ruth. First, Smith barely squeaked by winning this riding in 2022. Second, his constituents are pissed off at him for the disaster of the Muskoka-Algonquin healthcare campaign. And I know Grace will talk a lot more about this later. He has a huge uphill battle to maintain his seat, and I know from experience that our feisty Muskoka members will be battling him every step of the way. Where are you? Solidarity. Full of pride, Region 5 MPP Rick Byers of Bruce Grey Owen Sound has done irreparable damage to his community. Durham Hospital is in his riding, the one where the Ford government is moving all the hospital's inpatient beds to another facility, that one? Yeah, another great idea. Let me tell you that when I attended one of their community meetings, and I know Alan has attended as well, residents were outraged. They were fired up and organized, and it was amazing to see, and they protested these closures tooth and nail. So Rick Byers announced that he will not be running again. Oh. But I wouldn't be surprised to learn it was the community that helped him come to that decision. So for this riding, the options are wide open. So Region 5, let's get at it. So I am hopeful and super stoked about this, that our badass, fierce, and fiery ONA members will be the key in upcoming provincial election by flipping ridings. We saw the nurses in New Brunswick do it, and we saw the nurses in Manitoba do it. It is now our turn to do it. Okay, I want to hear from you. What are the issues that you think will matter in the provincial election? Shout them out. I want to go. Privatization? Who said privatization? I heard a bunch of people say privatization, healthcare, yes, staffing ratios. I wish it was an election issue. Education, yes. So healthcare privatization, before we get into it, let's play a video.
Premier Doug Ford is starving public health care of billions and funneling tax dollars into private care instead. He has one greedy goal: line the pockets of CEOs at the expense of everyone else. In 2023, more than $600 million taxpayer dollars went to private nursing agencies in Ontario. The Conservatives are expanding private surgery clinics, paying them 2 times more for procedures than public hospitals receive. Ontario's nurse staffing ratio continues to plummet, still dead last in Canada. Meanwhile, the Conservatives voted against a bill to introduce nurse-patient ratios in hospitals. But ONA members fight for public health care, better funding, and quality care for all.
Are you ready to fight? Yeah, right! Are you ready to fight? Yeah, right!
We fight their plan at every step. From the streets to the ballot box.
Are you ready to fight? I could talk for the next 2 days about privatization, but I won't. Well, I maybe will, but not right now. So Ford's Conservatives have been deliberately underfunding the public system for years. Meanwhile, they're taking public funding from the public hospitals to pay for profit care. For-profit clinics charge twice as much per surgery or procedure. See where we're going here? Can I get a shame after every one? Nursing agencies charge public hospitals up to 3 times more for nurses. Wait lists for people in the public system are worse because of privatization. For-profit medicine is more costly and dangerous. And you know that 25,000 plus shortage of nurses that we have in Ontario? Privatization is the main driver for this shortage. Take hospitals. They get underfunded, so they cut nurses and healthcare professionals. Shame. Those who remain are stressed, burned out, and unable to provide the care that they want to give because they're stretched too thin. Shame. They get fed up and leaving because of the unsafe staffing. And compound that with other Ford government policies, Bill 124, I'm looking right at you, then more nurses leave and they don't return. Shame. Ford's schemes are completely unethical and immoral, and that is true. And the only thing privatization does well is make money for the real people Ford's Conservatives care about. And it's not us. It's his rich buddy, and there is no defense for this BS. The nursing shortage in Ontario is severe. In this room, on Zoom, everyone knows this. And the Canadian Institute for Health Information tracks healthcare staff data, including these nurse numbers. And the data is where we get the nurse to population ratio every year. And you know, the one where Ontario is dead last? The last several years, and I can't even keep track how long. Ontario has had the worst nurse to population ratio among the provinces. It's a race to the bottom, and the facts are stark. There are only 651 nurses per 100,000 Ontarians. That's down from 661 last year. And how much worse can it get? Much worse. And I fear for our workforce, and I fear for our patients. And Ford could have passed a bill to implement nurse-to-patient ratios in hospitals, but he defeated it. That is a shame. And the bill could have been the spark we needed to rejuvenate our hospitals. But Ford's Conservatives voted down better nursing staffing in our hospitals. That is a shame. And the stakes have never been higher than they are right now. Ford and his Conservative MPPs must be stopped in their tracks. Do you agree? And I hope you agree, because we have the power to do it. If the provincial election wasn't enough, there could be a federal election on our way too soon. Next short while too. So PC leader, here I go again, Pierre Poilievre wants to be the next Prime Minister of Canada. We know that much is clear. And he must be stopped. And I don't have to tell you that he will dismantle public health care across the country and cancel important programs like dental care and universal pharmacare. And just like a certain premier we know, he sees public health care funding as an opportunity to enrich private shareholders. We must fight to protect public health care. And we have to do it at the ballot box and beyond. So who's with me? Another straw vote, raise your hand. How many hospital members attended the November 6th bargaining demands voting meeting? Should be all of you. Remember at June PCM, when's the meeting? November 6th. When's karaoke? 17:45. And we now have a clear path forward with our hospital provincial bargaining come January. Right, Jason? Yeah. Hospital members overwhelmingly approved the initial bargaining demands that will be presented to the Ontario Hospital Association. I think it's great. We have a great team. And negotiations manager Marilyn D. will give additional details in her report. And if you don't already know, we will fight to get what our members have directed us to achieve. We have many actions planned to support our negotiating team, including, what are we doing tomorrow, gang? Who else can't wait? Come on. We will achieve results at the bargaining table through our actions. You've heard me talk about this time and time again. It has been proven, and we are going to do it. Now, it won't be easy, but we are ready, and it starts tomorrow. It started before tomorrow, but we are going to be on tomorrow. So our Victorian Order of Nurses members, where are you? Will be in provincial bargaining earlier next year as well. How many of you are here? Lauren is here. Okay. Oh, they might be in the overflow. Okay. And although they are few, they are certainly mighty. Here's where we all come in. With the strength of more than 68,000 members behind them, they will mount their first ever provincial campaign to put pressure on their employer to meet their demands for wage parity and respect. And our Victorian Order of Nurses members will be sharing testimonials of what it is like to be a nurse in home care and the important role they play in our healthcare system. They will be hosting a phone zap to directly connect with elected members of provincial parliament to demand better. And this is coupled with targeted videos, video ads, opinion editorials, and a number of other ways to get out and get loud and show our support for VON members. So we know their employers will be shaking in their boots come April when they begin bargaining. So let's make ourselves heard. Who is going to support VON members? I will be. So we have a lot of fights ahead. And it's the nature of the work we do as advocates for our patients, residents, and clients, and as advocates for publicly funded and publicly delivered healthcare system. And we cannot hesitate to call out the bad bosses. Each and every one of us has the ability, the talent, and the drive to do it. You do. And as I said earlier, our credibility as nurses and healthcare professionals is a powerful tool against bad bosses. We need to call out the people at the top and be bold and be fierce. And I know there are members in here and everywhere that may not feel comfortable having these conversations yet, and I get it. But I want you to ask yourself right now, what has behaving yourself ever gotten you? If you stood in the corner and patted on the head, you were seen and not heard, did it get you anything? That's Bernie's line. When you're polite, does your employer actually give you respect? Do they improve your working conditions and wages because you're nice? Do they include you in real decision making? No. No, they don't. They keep you out of the way so that they can do whatever they want. And you know what evidence shows. You know the facts, and we must be assertive. We must be willing to tell it like it is. We need to be willing to call out bad bosses and fight back. And that's how we get real power. We build it collectively, and we make the choice. We will not fear power. Now, who's with me? You're with me, Kenny? So when I see women, nurses, and healthcare professionals taking control of their future and mobilizing and standing up for their rights, it is honestly everything to me. So I say, rise. Our fights continue. And there are powerful, powerful forces, not as powerful as us, that will attempt to stop the progress we have made. And it will only be through our determination and commitment as healthcare professionals, working within a democratic and grassroots union, that we will defeat these powerful forces. Never forget, I said it earlier, you are never alone in this fight. This is a movement. This is your ONA, your board, 68,000, listen to that number, 68,000 badass members supported by ONA staff are with you. We boost each other up when things get hard. They've gotten hard. We're still here. And we make sure the bosses know that we're in this together. Our actions matter. Our voices matter. And when all 68,000 of us stay together, then the tables will be turned. Thank you.